So today I want us to talk about high blood pressure in pregnancy. I know you're still streaming in, and I know this is a very serious condition, and it's affecting so many moms in this day and age. And if you don't know what to do, or if you don't know what it is, and if you don't know what to expect, then definitely you may be in dark, and it can cause a lot of serious problems that we are going to talk about. So guys, my name is Nasteri, and I help moms like you prep for labor and birth. So if you're there and you're pregnant and you've not gone through prenatal class, a labor and delivery prep class, then you are late. Kindly join me. There are some links that I'm going to add there in the in the video description, so that you can join our class. I really love doing the lives. Sometimes I'm not able to, but when I'm able to, why not? Because at least engaging you on a live on a live way. So I think it's really good that way. So last year, I think around last year, a time like now, I was invited to a workshop. And this workshop, we were talking about hypertension in pregnancy. And in that workshop, there were some women who had been brought, and these women called themselves preeclampsia survivors. And what I found out from those women was so heartbreaking, because I didn't know that women or pregnant mothers can suffer all that, because we as healthcare providers should be or are equipped with this knowledge, so that you don't have to survive. You should thrive during your pregnancy. So I am going to educate you about this condition, high blood pressure in pregnancy, so that you can know what it is, you can know what it can cause, and number three, you can know what to expect as a pregnant mom. Even as maybe you are diagnosed with this condition, what should you do, or what should you expect? So, high blood pressure in pregnancy, I would say, or I can define it as you go to the health facility, wherever you go for your prenatal checkups, and then your midwife, your doctor performs a blood pressure test, and they tell you, Alice, you know what, your blood pressure right now is reading at 150 out of 96 millimeters of mercury. That one, it's an elevated blood pressure. And we say that preeclampsia is characterized by a high blood pressure reading. So if your blood pressure reading is at least greater than or equal to 140 out of 90 millimeters of mercury, and your healthcare professional has taken this reading at least 4 hours apart for two times, and this reading is still high, it's still greater than or equal to 140 out of 90 millimeters of mercury, we say then that this could be you are having preeclampsia, and preeclampsia is characterized by an increased or an elevated blood pressure reading. Or you go to the healthcare facility, and when your blood pressure is taken, the reading is greater than 160 out of 110 millimeters of mercury. If your healthcare professional takes just one reading and they find this blood pressure reading, then they're going to tell you that, well, we are afraid that you may be having preeclampsia. And preeclampsia normally occurs from week 20 in a person who didn't have high blood pressure before. So if you had high blood pressure before, we cannot call this preeclampsia. So for those who are joining us, we are talking about high blood pressure in pregnancy, because it is a very serious condition. So we've defined preeclampsia. It occurs from week 20, and those are the readings of the elevated blood pressure reading. So that is what it is. So what can this high blood pressure cause? What can it cause in your body? One thing that you need to know about preeclampsia is that the problem normally comes from the placenta. So there's a way that your placenta, some cells in your placenta called in what are they called, extravenous trophoblasts, those ones. I know it's a huge word, but those ones, there's a way that they malfunction, like they are not able to cause some arteries that are called maternal spiral arteries to broaden. And when these arteries do not broaden, then there is going to be high resistance. Like when the blood is going to try flow into the placenta, it's going to encounter a lot of high resistance, and this is what causes high blood pressure. And this normally spirals to a lot of places in your body. That is why we say it is not a localized issue, it is a systemic issue, because it's going to affect a lot of places in your body. One thing that preeclampsia does is that it is going to cause a lot of damage to your blood vessels. This can cause a lot of issues such as clotting problems. So you can see a mom with preeclampsia having bleeding problems. A mom with preeclampsia can have issues with the liver. A mom with preeclampsia can have kidney damage. A mom with preeclampsia can have seizures, what we call eclampsia. They can have brain damage. So a lot can happen, and this can actually cause maternal and fetal death, which is unfortunate, and we should not get there. So when you go to the healthcare facility and your healthcare provider takes the blood pressure readings and they tell you that your blood pressure is high and you're pregnant from week 20, you should not just go home. Make sure that you have or you've been given some antihypertensives to bring down this blood pressure, so that this does not progress and cause the complications that we've talked about. For example, bleeding problems, for example, damage to your brain, damage to your kidneys, damage to your liver, because preeclampsia is not a good thing at all. And it can also, because the placenta is not getting enough blood supply, the baby definitely is not going to grow well. So these babies normally get something we call intrauterine growth retardation. That is, the baby is not gaining weight, the baby is not growing well, and you can get a low birth weight baby. And if you've been diagnosed with preeclampsia, you should expect, especially if it is mild preeclampsia, you should expect at least blood pressure monitoring, which should be frequent. You should, of course, have frequent blood pressure monitoring. Your doctor may also do some blood works to check some things such as, complete blood count to see how are your platelets, things like that. How are your other clotting factors that we normally take? So blood works, urine tests. Your doctor is also going to do some urine tests. So those are some of the things to expect, and you should cooperate when you're told that you have high blood pressure in pregnancy. Make sure that you are cooperating when you're sent to the lab to do these tests, these diagnostic tests, urine tests. Please don't complain. Go and do the blood works so that your healthcare professional can know how to better manage, and so that they can diagnose you properly. Is it mild preeclampsia? Is it severe preeclampsia? Because they are managed differently, and so that this does not progress into eclampsia. So eclampsia is preeclampsia that has not been managed, that has complicated, and it has now become eclampsia, which is characterized by you going into or having convulsions, which can cause brain damage, can cause eye damage, can cause kidney damage. And I've also seen a lot of these issues, which is not a good thing. So that is what I really wanted to talk about. I know I have tried to explain this in very simple terms: high blood pressure in pregnancy, and you should never ignore this at all. So if you're a pregnant mom, ensure that you are adhering to your prenatal appointments so that your blood pressure readings can be done frequently. And let me know, do we have any questions so far? Oh my goodness. Okay. Any questions? Any questions on about high blood pressure in pregnancy? Let me know so that I can be able to answer that. So if you're just joining in, please just start from the very beginning. It's a very short live session, and we've talked about high blood pressure in pregnancy. And let us now talk about symptoms before I wrap up this. How can you know that you have preeclampsia? One of them, we've talked about elevated blood pressure readings, and another thing that a person or a mom with preeclampsia can have is severe headaches. So if you're having severe headaches that are persistent, and when you try to take maybe over-the-counter pain medications, this is not working, it is a clear symptom of preeclampsia. Another thing that you can have is epigastric pains. So if you're having epigastric pains like right here, if you're having pain there, and when the doctor is palpating you on your right side, you're having some pain around there, it could be also a symptom of preeclampsia. Also, if you're having blurry vision, like your vision is blurring and you're seeing some flashing lights like that, it is also a symptom of preeclampsia. Also, there are some moms who will present with things like, for example, they'll tell you that I'm not peeing well, or I'm peeing very little urine. That one you can only get from when a healthcare or your midwife asks you that. Gosh, I don't know whether you can hear me, guys. My microphone is off. So, and then another symptom that you can have is cough and maybe difficulty in breathing. That is a very serious, now it is a serious symptom showing that preeclampsia is now heading to the severe bit. So those are some of the symptoms that you shouldn't ignore if you have, or if you suspect to having preeclampsia. So I think I'm going to end there because my phone has suddenly decided that no charge. So I don't want to just go blackout. So that's it, guys. I hope you've enjoyed this live session. God bless you, and I'll see you in our next live session.